How do patients get access to their GP electronic health records? I've been doing this now since 2004 and I've learned a lot about how to do this. The first thing is to not just assume that they will just do it if you tell them to. And so it's really important to explain the why when you're talking to patients and explaining to them why they should get access to their medical records. The NHS is under massive pressure at the moment, and more is expected of all of us, and it's becoming almost impossible for us to be able to do our job safely. Patients, carers, and information are the most underutilized resources that the NHS has, and that's why it's really important for us to try and help patients to understand what they can do and why they can do it to help them. So when you're seeing a patient and you're not sure what's going on, or you're going to arrange some blood tests, or you're going to do some investigations such as an X-ray, an ultrasound scan, or you're referring them to the hospital, or you think that they might become poorly and they might end up having to go to an out-of-hours service or an A&E in the evening or at the weekend. Those are the kinds of times when, at the end of your consultation, when you're finishing off and your housekeeping, if you like, that you ask the question, oh, by the way, do you have a smartphone? Do you have an email address? Would you like to be able to access your medical records so that you can read the information that you've provided for them and also be able to share that information with whom you like? Often patients will say yes. Now at that point there, rather than just sending a link to them, actually go to the web practice website, open up the web page which asks the questions and go through it with the patient there and then. Explain to them that you download the NHS app and then are you happy to use a password to log into the medical record? Check with them if they're happy to be able to see what you've written in the consultation. And again, when there's a lot of things that you need to ask the patient to do and you're trying to remind them of it all, it's a great opportunity for them to be able to then just read it instead of trying to remember it all. Ask them if they'd like to give you feedback. Ask them how they feel about what they would do if they didn't understand something. And usually patients will say they'd contact the GP surgery. Occasionally they might say go to an A&E department or go online and Google it. I try and discourage that because of course if you go to Google, you're almost certainly going to end up with cancer and dying, aren't you? And instead point out to them and say the practice website is a useful resource, but of course they can also contact the GP surgery. Secondly, ask them what would they do if they read a letter that wasn't theirs and it was somebody else's, and encourage them to contact the GP practice rather than doing nothing or ignoring it. And then thirdly, would it upset you if they read something that somebody else has said something about them? Patients will usually say no. Occasionally patients might say, I don't really understand what that means, in which case you could say, well, imagine if you were drinking a lot and your partner, your friend, your neighbor, your friend, your work colleagues worried about you, and they end up ringing the GP surgery and saying that they're worried about you. And if you then read that, would that upset you or not? And then finally, do they understand what record access means? Now, in the same way as I've just done this in about 30 seconds, often it can be somewhere between 30 seconds to a minute to do that. And that's all we're asking you to do in a consultation, is spend that 1 minute, get that questionnaire done, confirm their email address, and then once you've completed the form, just send me a message to say a form's being completed, can I process that request? I will then look at the records, look at the answers, check if there's any reasons why I can't give them access to the records, and then send them a text message to confirm that they've got access to the records, or a message that goes straight to their NHS app, or secondly, and also to email through to them their PIN numbers if they haven't yet registered on the NHS app. And that's it. That's all you need to do. And if you could try and do that, that'd be really helpful. The only other thing is when you're looking at the medical record, look in the summary screen and look at the problems list and the significant active one. And in there, it should either say patient e-health record enabled or patient remote record access enabled. And that indicates that at some point in the past, that patient has actually completed the questionnaire, in which case they don't need to repeat it again. They just need to be activated if it's not working. And again, if you come across a patient like that, then tell me about it so that I can then process it and get back in touch with them. If you still have any questions, then please feel free to get back in touch with me. Thanks very much.